In this week's Cardiology Countdown, we talk about whether we should be vegetarians, also look at bare metal stent versus drug-eluting stents in STEMI, a high-risk group, and finally get a quick peek at the new heart failure guideline. So to begin with, there's a patient that looked at dietary questionnaires in about 100,000 people followed for 5 to 6 years. And interestingly found that any vegetarian diet was associated with a lower mortality and cardiovascular mortality. And this held up after adjustment for other baseline characteristics. So I think an intriguing thing, of late, people have changed the name to vegetable-based diet, but in any case, avoiding saturated fat may be of great benefit, at least suggested by this study. Next up is a very nice meta-analysis that has been done of a very hot topic, the use of drug-eluting stents in acute ST elevation MI. There had been a scare back all the way in 2006 of stent thrombosis in STEMI, and so people have hesitated about drug-eluting stents and STEMI. But the data from randomized trials have actually been pretty uniformly reassuring. But despite that, there's been concern. The group at Columbia did a meta-analysis of now 22 randomized trials involving 12,450 patients, comparing different generations of drug-eluting stents with bare metal stents. And what was found is that event rates were lower in the drug-eluting stent group. So beginning with the cobalt chromium everolimus eluting stent, there was a significantly lower rate of death or MI compared to bare metal stent, also a lower rate of stent thrombosis. This happened early and was maintained out through 2 years follow-up. In addition, compared to paclitaxel eluting stents, better event rates. Sirolimus eluting drug-eluting stents have been found to have a lower rate of death or MI compared to bare metal stent as well. All of them except the zotorolimus stents have reductions in target vessel revascularization. And so while there's fear that things may be worse, the evidence actually shows that drug-eluting stents, and certainly the newest generations, have lower event rates compared to bare metal stents in STEMI. And the number one pick this week is an update to the heart failure guideline. This is a very comprehensive look that involves diagnostic evaluation, who should get which biomarkers, when should we have testing, how frequently should ejection fraction be tested, what about more advanced imaging. Also, the therapies of what medical therapies get class 1 recommendations, which ones have been proven not to be helpful. Interestingly, statins don't pan out without another indication in heart failure. Then also, obviously, who should get an ICD and CRT therapy. And finally, the high-risk group of patients, or vexingly difficult group of patients, patients with preserved ejection fraction. So all of these get very clear, color-graded, evidence-based recommendations. So encourage you to look at the guideline, the summaries that we have, and other videos highlighting the content. So for this week's Cardiology Countdown, I'm Chris Cannon.